There are about 13 different meanings in the Han language for qi, and not one of them is energy. In fact, the word energy doesn't even appear in the Han language. And so now suddenly Chinese medicine, which really is a cardiovascular medicine, suddenly got driven off a new age cliff, never to return. Health is defined as highly oxygenated, highly nutritious blood coursing through the human body. That's a healthy person. It has nothing to do with psychic energy meridian. If you ask any philologist who has a PhD in the Han language, some of them can get pretty wound up when you mention qi being energy. They'll say that this has no historical basis whatsoever, this translation. The acupuncture points are not called acupuncture points. They're called jiet, which translates as neural node. You stimulate those neural nodes with a needle, and it has an effect on blood flow in the node that's associated with that blood vessel. When I came out 20-some years ago and began to tell the Chinese medical community around the world that qi doesn't mean energy, I swear to God, there's Satan, and then there was Bob.
I've got Dr. Doane with me today. He is actually one of my neighbors here, I just found out, so he's not far from where I am up in Washington State, a practitioner of Chinese medicine. And Dr. Doane, I guess just maybe if you don't mind, take a minute or two to introduce yourself, and then we can talk about the various topics you want to get through today.
First of all, my name is, of course, Bob Doane. I'm not a doctor. In the state of Washington, my title is AEMP.
Okay.
I don't know how they came up with that one. That's Acupuncture Eastern Medical Practitioner. And
Sure.
You have different titles in different states. That's the title they give us in Washington, those of us who have master's degrees in Chinese medicine. And I'm 77, so I have an interesting background. I started out in physics. I have a degree in physics from the University of Washington. I lived the life of a monastic. I was a celibate monk for 10 years, a couple of years in silence, and the rest of the time teaching meditation around the world. And then I ended up owning and operating Channel 18 television in Los Angeles for about 6 years. And then I entered into the oil business in Houston. I had 3 oil brokerage firms in Houston. And then at 40, I sold everything and retired, basically, and got very bored. And then I went to Chinese medical school and picked up a degree in Chinese medicine, started a little practice in Paulsbo in 1998. And it just grew. By 2004, it was pretty sure the largest practice in the United States. We see 100 people a day, 5 days a week. That's why I'm tired.
You've packed a lot into those 77 years, sound like. Gosh, 10 years as a monk and 2 years of silence. Not many people can make that claim. But you, before we started recording here, you mentioned there's some misconceptions about what even Chinese medicine is, and I probably suffer from those same misconceptions. So I know you wanted to maybe enlighten us on that. So what is that? What is actually Chinese medicine for those who don't know?
It's an ancient medicine. It's 2,500 years old. And all the original medical texts are written in a language that's been lost from common usage in China for 300 or 400 years. The medical texts are written in the early Han language. And a lot of the pictograms look like Mandarin, but they have a different meaning. And so when Chinese medicine first found its way into Europe, late 1600s, no one took it seriously, because medical science at that time was dominated by Christian thought. And so here comes this medicine from a barbaric country, so no one of any import paid attention to it. And it floundered around like that until the early 1930s. And a French diplomat in China who spoke perfect Mandarin, his name was Sully de Meuron, who was an intellectual. He'd written books on Chinese culture, Chinese music, Chinese art, and he decided to write 3 books, one book about Chinese medicine. And he went back to the original classics and he produced this book. And because he has intellectual credentials, that book was taken seriously around the world. There's only one problem. He mistranslated everything. And so that was the first guy on the planet to ever translate the word qi as energy. There's only one problem. It doesn't really mean energy. There are about 13 different meanings in the Han language for qi, and not one of them is energy. In fact, the word energy doesn't even appear in the Han language. Qi translates in a medical sense as vital air, or the essence of air. And they're very clear about where it is. It's traveling with the blood through the vascular system. So in a modern term, the closest thing you could come up with is that qi is oxygen. It's not energy. And unfortunately, Sully de Meuron's mistranslation stuck. We have Chinese medical colleges pumping out degrees in Chinese medicine, and it's really not Chinese medicine. It's what I call it French energetic medicine. It's not really accurate. And then Sully de Moran made another egregious error. He mistranslated two words, jouet mai, blood vessel. He actually translated those two terms as an energy meridian. And so now suddenly Chinese medicine, which really is a cardiovascular medicine, suddenly got driven off a new age cliff, never to return. And so people are walking around with degrees in Chinese medicine thinking that they're balancing the energy in your body. It's simply not true. And it's really unfortunate because it's such a beautiful insight into what happens in the body when there's restricted blood supply or nutrient supply in the body, what can happen physically to the system if there's any restriction in the flow of nutrient. And that's the basis of Chinese medicine. Health is defined as highly oxygenated, highly nutritious blood coursing through the human body. That's a healthy person. It has nothing to do with psychic energy meridians. So I think we should clear that up. If you ask any philologist who has a PhD in the Han language, some of them can get pretty wound up when you mention qi being energy. They'll say that this has no historical basis whatsoever, this translation. And those of us in the Chinese medical community that keep calling qi energy is simply not, it's not accurate at all. This is a physical medicine. It's totally physical.
So and I don't know a lot about Chinese medicine. I know acupuncture is widely practiced within that, and a lot of that is meridian based. Correct me if I'm wrong, or I think that's the thought behind that. And you would say that's based on basically a flawed premise. Is that fair to say?
Wrong. The description in the oldest classic is the Wangdi Neijing. It's very clear that these are not energy meridians; they're blood vessels. They actually have the length of them. They're what color they are at the wrist. If there's too much red around the wrist, there's too much heat in the body. If it's too blue, there's too much cold in the body. If there's purple, there's too much blood stasis in the body, ecchymosis. It's pretty hard to see with the visual eye a psychic energy meridian. And it's certainly hard to actually measure the length of one. So there's the Wangdi Neijing, the oldest classic, is replete with descriptions of the physicality of the mai, of the vessels. And so, acupuncture is not based on energy, on a meridian at all. It's simply stimulating neural. But in the Han language, the acupuncture points are not called acupuncture points. They're called jie, which translates as neural node or nodes, neural nodes. You stimulate those neural nodes with a needle, and it has an effect on blood flow in the node that's associated with that blood vessel. Acupuncture is a neurological phenomena, and its overall effect is to increase blood flow into the targeted area. And
so in
research to show that.
And so I come from an allopathic medical background. I'm an orthopedic surgeon by training, and so what I would look at that is there's clearly an autonomic nervous system which has been described very well. Those do have impacts on blood flow and so on and so forth. And so are you saying that interacting with that system, I guess to put it in terms I might understand, by needling these certain areas that would stimulate these parasympathetic, sympathetic nervous systems to act a little differently to modulate the blood flow. Is that a fair assessment, or am I off base on that?
Shawn, I think it's good. The truth is we don't actually know exactly how it works. In Western medicine, we don't know exactly what pain is exactly. There's theories and there's dominant ones. And so you start to talk about pain relief with acupuncture. You're talking about, it's a theoretical construct. But the best guess of what we can see is how it works is that it has to do with pain. And people in chronic pain, you have to ask the question, why isn't the body that has a natural mechanism for treating chronic pain, why doesn't the body take care of that chronic pain? Why the body can release its own enkephalins, painkillers, and they plug up all these pain receptor sites along their spine, along the capillary bed where the person hurts, and in the brain itself. People in chronic pain, obviously that enkephalin release mechanism is not working. And the question is why? We don't know exactly, but it appears to have a lot to do with the proprioceptive pathway. Of course, people in pain, the sensory nerves are working perfectly because you feel the pain, right? But you cannot stimulate a sensory nerve without stimulating the nerve right next to it, which is proprioceptive. That's why when you touch anywhere on the human body, you immediately know the pressure, how hard you're being touched, but you also know where you're being touched. That information is being delivered to the midbrain by the proprioceptive pathway, and there's just millions of these proprioceptive nerves all over the body. You can't touch anywhere in the body without firing one of those off. And it appears that what happens is if the signal strength on that proprioceptive pathway is too weak into the midbrain, the body simply won't release those enkephalins. The mechanism doesn't really work, and people get stuck in chronic pain cycles. So with these acupuncture, these little tiny wire needles, what they do is they basically stimulate the proprioceptive. They keep jumping that proprioceptive signal, and pretty soon you reach threshold, and here comes the enkephalin release. And so acupuncture done properly, that mechanism can take place in 10, 15 seconds.
So there's a concept, I think it's called TENS, transepidermal neural stimulation, that's often used in some of those. Is that sharing a similar sort of physiologic phenomenon with the TENS unit?
I believe so, yeah. There's two types of acupuncture. My method is a distal method. We don't put needles in the local pain because that could trigger, the area already is in pain. The midbrain knows it's in pain. The midbrain is actually, through descending control, is causing a lot of guarding in the area. There's vasoconstriction in the area, probably a genetic defense mechanism, probably 10,000 years ago. If you were hurting, it was probably infected. So the body didn't want the infection distributed throughout the body, and then, because of course you can die. So the body's mechanism is to clamp off any area of pain that's chronic, and the body's willing to sacrifice the knee other than dying. So you got a lot of guarding, a lot of vasoconstriction whenever there's any inflammatory process going on in a joint, anywhere in the body. And so to put an acupuncture needle in there, you're actually causing more inflammation. So the brain just clamps down even more. Now, one could argue that the local needle is causing a local, because it increases inflammation, sort of like it was that old technique from where you put saline into I forgot, they used to stick saline into pain and cause massive inflammation, because if you create more inflammation in an area that's already chronically inflamed, it's possible the increased inflammation could heal the area. And
Sclerotherapy is something that's often used for, like,
yeah, exactly.
saline injections into varicose veins. Yeah.
I've seen
Prolotherapy,
that.
I think, has been with glucose, but yeah, okay, yeah.
So we think that we use a distal, my method is called DNA, distal needling acupuncture. And we just we don't stick those needles in the direct problem, because we think the problem is really in the brain. We're treating the brain. We're trying to get the brain to do what it should do, is shut the pain down.
So if I were to have, say, shoulder pain, the needles would go into my wrist hand area, typically at the end of the nerve conduction pathways, I would assume, correct?
The Chinese were just genius. They mapped out all the major neural pathways, vascular pathways, and they did it longitudinally. And so if you're hurting the shoulder, they want you treating the distal joint, which would be the wrist, the hand, the ankle, the foot. And done properly, the shoulder pain, as long as it's not a structural problem, if there's nothing actually stuck into a nerve, which is a surgical procedure, we're not going to fix that with acupuncture. But if it's a neuropathic kind of pain, where the whole neural area is inflamed and throbbing, and the body can't figure out how to shut it down, even though there's nothing really pushing on it anymore, that's acupuncture done properly works perfect for that.
So a patient that would have, we used to call it RSD, reflex sympathetic dystrophy. Now it's been renamed chronic regional pain syndrome, and there's different versions, 1, 2, and so on and so forth. Are those the type of patients that would be amenable to this? Because that is basically a neuropathic issue, I think.
Yeah, it works perfect. It's like magic. And but it won't work if you stick a bunch of needles in the area of discomfort. It just doesn't work very well. We could say maybe it works half the time, but that's not good enough. In the medical world, I'm like the weird uncle that nobody wants to talk about at Christmas. And we have to produce tremendous results immediately. Otherwise, people, because of that energy nonsense, people think the energy doctor didn't work very well. So yeah, we have to produce 80, 90% results, and we just can't get away with a 50% efficacy rate.
How do you, I guess it would work. If you have someone with back pain, with axial pain, are you still doing it? Like if they've got back pain, then your needles would go in the legs? Is that how it would work, or how would that work?
There's, in my method, which is based on the Neijing, the Wang Di Neijing, there's many areas of the body that you can needle that share the same real estate in the cortex of the brain. with your lower back. So you want to stimulate those areas where the signal goes into that area of the cortex that wakes up that area that's also involved in the back pain. And it turns out that if it's lower back, L5, 4, 3, 2, 1 in that area, then the best needling is around the knees, the elbows, wrists, ankles, hands, feet.
You said at the beginning the purpose of this was to deliver oxygen and nutrient-rich blood to the affected area so that, I guess, healing can occur. I guess that's correct me if I'm wrong on that. What about the inputs in there? Because chronic smokers, they probably don't have as much oxygenated blood. People's diet is garbage, probably don't have as much nutrient-rich. Do you get into that at all? Is that part of your calculation is to increase the efficacy of what you're doing?
Systemic diseases in Chinese medicine are mostly treated with Chinese herbs. Acupuncture's efficacy is pain relief. And if you went to any famous Chinese doctor in China, a professor at a college, and you asked them if they did acupuncture, they'd probably be insulted. Because in China, the herbalists are here, and the acupuncturists are like the physical therapists. If you went up to a Harvard thoracic surgeon and asked them, oh, do you do physical therapy? They might be insulted. And that's how it is in this business. So in terms of all these sort of organ diseases, respiratory problems, heart disease, coronary artery problems, we use Chinese herbs for that problem. Now, how does acupuncture increase blood flow in an area? We could come up with a reason why the acupuncture could stop the pain. But how does that lead to increased blood flow into the targeted area? Once the midbrain is no longer getting pain signals from your knee or your elbow, the brain releases the guarding. There's vasodilation, there's an increase of blood flow into the area, and the whole healing mechanism begins. And we've taken probably 3,000 thermograph studies that we've done over the years. And it's just amazing. An area, you shoot the area initially and it's all black, which means very bad circulation. And then within 15, 20 minutes of the acupuncture, the whole area is nice and bright, white, red. It really increases blood flow, even though you're not needling that area.
Yeah, it's all modulated by the nervous system, I would assume, increasing blood flow. I was looking at your website earlier this morning in preparation for this, and there's a concept that you use, something called medical pulse diagnosis. Can you describe what that means and how do you apply that?
Sure. In Chinese medicine, one of the 4 pillars of Chinese medicine is palpation, which refers to pulse diagnosis. And that's basically grabbing the wrist and feeling how the blood flows through the radial artery on both wrists. And this has been around for at least 2,000 years. Unfortunately, it's a lost art. And even though we study it in medical school and we learn about it, we really don't know how to do it because the professors don't know how to do it. And there are people in China that can do it, but they generally won't teach anyone. It's like job security. So there's usually some old master in every hospital. And so when they have a problem, they'll say, go get old man Chu. And he comes down and he'll say it's the liver or it's this or that. Pulse diagnosis done properly is just extremely revealing because you got your hand, basically the radial artery is what? Just an extension of what? They're all connected, subclavian, brachial, radial. So when you touch and you're grabbing how that pulse feels at the radial artery, you really have your hand on the pump. You can tell a lot about the cardiovascular system when you can feel that pulse. And medical pulse diagnosis is a technique that I developed years ago. I didn't dream it up on my own. I tracked down at the time what I thought was the best in the world, and he was willing to teach me. That was years ago. And so I got my start from that gentleman, and then over the years, of course, like anything in medicine, you alter it, you try to improve upon the method. And several years ago, I printed a book called Medical Pulse Diagnosis, which is a how-to. It's actually how to do it. Almost any book you pick up on pulse diagnosis is not really how to do it. It's about the topic because the people writing the book don't really know how to do it. But in this clinic, that's the basis of what we do here. We can tell a great deal from the pulse. It doesn't replace radiology, but boy, it really can tell you a lot of stuff, especially cardiovascular problems.
Yeah, I can certainly see where cardiovascular. Now, obviously, that depends upon, I guess, the practitioner's familiarity and comfort and how well they can assess a pulse through digital measurement. Are there machine? What about an EKG? Would that tell us something similar? Could we get some of the similar information about what's going on in the rest of the body? If what you say, you can assess the liver by feeling the pulse. How does that work specifically?
That's a good question. You're so smart. It makes sense that you could tell a lot about the pump. I think you guys in med school, you ever remember them talking about the water hammer pulse?
Mm-hmm. Yeah.
Yeah, you can feel that easily. It's an up-down pulse, and it has to do with the aortic valve. If it's stenotic and leaks, then on systolic, it'll produce a high systolic bump in the radial pulse, and then that pulse will disappear back under your finger. So it's an up-down pulse like this. And when that's over all pulse positions, you have a pretty good idea there's something wrong with the aortic valve. And that makes sense. Or if the heart's weak and you have your hand on that pulse and you have a very thin radial artery, paper thin, that person is obviously anemic. There's not enough blood volume. The heart will be weak and they'll be pale and cold and tired and they can't sleep and they're anxious and so forth. That all makes sense. But to grab what we call the Guam position and the radial artery, which is the middle position, and tell you your liver's screwed up, that doesn't make a lot of sense. And it's just anecdotal. There are the way the pulse feels in certain positions is anecdotally correlated with how a certain organ functions. So in these pulses, you have three positions, Sun, Guan, and Shi on the radial artery. And the Sun position near the wrist will tell you on the right hand what's going on with the large intestine and the sinuses. The right Guam position will tell you what's going on with the pancreas and the stomach. And the right, what's called the Shi position, which is more proximal up the arm, will tell you what's going on with the bladder and the kidney, the western bladder, western kidney, and the shoulder and upper back and neck. And when you flip over to the left arm, the left Sun near the wrist, that position will tell you a great deal about how the heart's functioning. You're getting a lot of information from it. And in the left guan is the liver gallbladder, and then the left Shi is the sex hormones, the sort of woman's gynecological area, lower back area, things like that. It's very difficult to explain how a certain pulse could relate to an organ other than the heart. But clinically, it just works. It's really. I'm sorry to interrupt, but a few years ago, I had my staff came in and said, "Hey, there's a bunch of guys out here that want to see you." I said, "They have an appointment?" They said, "No." And they said, I said, "Do they look smart?" They look really smart. Send them in. So here these four guys come in here. And I said, "Okay, what's this?" And they said, "We're here to meet you, and we want you to read our pulses." And I said, "Is it a test?" They said, "Yeah, it's a test." I said, "Okay, let me look at your pulse." So I went through each one of them. I said, "Well, you got this and this." And they were like stoic. They didn't say anything. So after all four of them, I looked at them and said, "How did I do?" And they said, "You got it all." Everything said, "Yeah, you got it all." And I said, "Okay, tell me who you are." Say, "I'm Dr. Furness. I head up the lead department, University of Washington. This is Dr. So-and-so. He's a PhD in physics. This guy is a PhD in math. This guy is a structural engineer. And we want to create a machine that can duplicate this pulse method of yours." And so we entered into a little business called Pulse Tectonics, and they immediately raised $1 million or so, $2 million, and they set to work to try to figure out how to do this. And in the end, they had discovered a lot of things, but it was very, very difficult to do it because you have to be exactly in the right position. And if you have a machine, it can move around on the wrist, and then you've lost the position. But the reason I'm bringing this up, I was giving a lecture in Australia because I teach in different parts of the world. I was in Sydney, and I got a call from Tom. He said, "You won't believe it. We figured out why these positions are different in the Sun, Guan, and Shi. Because it doesn't make sense logically. Why would a pulse feel different? The same radial artery, why, if you're feeling literally 1 inch, each position is about 1 inch from one another, why would the pulse feel different in those positions?" These guys figured it out. They got their hands on some time-lapse photography equipment, and they got some sort of algorithm they used, and they got a very thin person where you could actually see the pulse. And they filmed the whole thing and then slowed it way the hell down. And it's amazing. What they discovered is that blood will flow down the radial artery unimpeded. and then it hits the scaphoid bone, and it dives under the scaphoid bone, of course, and it innervates the hand. But when it hits that scaphoid bone and goes under it, it hits a bulkhead, and so it creates a back eddy in blood flow. So now everybody has blood going down the radial artery, but then they have blood, a little bit of blood coming back. It produces an interference pattern. And that interference pattern exactly corresponds with these positions, Sun, Guan, Shi, and it will show that maybe there's a big pulse in one position and no pulse in another position. Thus, the pulse can feel different in these positions. And so they were very excited about that thing. And I think that really answers an age-old question of how in the hell can the pulse feel different in different positions? But it can.
So you said this is derived. It was originally developed during the Han Dynasty some 2,000 years ago. How do you, or maybe it's recorded, how they figure this stuff out? Because I would obviously have to take just thousands and thousands and thousands of observations to say that. And how would you don't have a way to die? You can't cut people open. You don't have radiology. How do I assess their liver and then correlate it to their pulse? I can just see the challenges that drive. Do they talk about it in the writings? How this was derived?
They do. They talk at length about it. They talk about how they really go in depth how the physiology runs, and they got it right in a lot of cases. They were wrong in some cases, but they got it right in a lot of cases. They were the first ones to figure out that we have a heart that pumps blood through a closed circuit system, and they define the blood vessels by size. So they have a word in the Han language, it's Shu Jing Huo Shui Tong. In other words, Shu Mai, or the big descending aorta, the subclavian, the vertebral artery, those are the Shu Mai. Then you have these Jing Mai, which are large longitudinal vessels running down all the way to the feet, like the femoral artery. The biggest Jing Mai of all is the aorta, is the descending aorta, which is called the Chong Mai, the sea of blood vessel, which they said is the largest vessel in the body. And it's true. It is. It's huge. And then they have these things called Lo Mai, which they call collateral vessels. Those are the blood vessels that branch off the Jing Mai, the longitudinal ones, and those are the organ vessels, the arteries that feed blood into all the abdominal organ system. And then they have this thing called Sun Mai, which are, Sun in Han means very, very small. And those are obviously your arterioles and venules. So they figured all this stuff out, and in the Neijing they write, we figured it out by the usual method. They keep using this term, the usual method. And guess what the usual method was? Dissection. And they weren't allowed to do dissection in the early Han and in later Han as well. So how did they do that? They would sneak into graveyards at night, pull out bodies and open them up and trying to figure out, okay, what's going on in here? What's really interesting, they were the first ones to label the internal mesentery system as a separate organ system. They called it Sanjiao, and they called it it was the upper mesentery, middle, and lower mesentery. Upper mesentery included the pericardium. So all these membrane systems, because the vasculature has to punch through those protective membranes that encircle every organ. And so they theorized that there's a problem in this membrane system. If it's pinched or harmed in any way, it will affect blood supply into the organ system. So they identified an actual organ called the Sanjiao. Now, unfortunately, over the years, Sanjiao got, believe it or not, in Chinese medical school, they called it an energetic psychic organ. But if they actually go back to the original book, they actually draw a picture of it in the Wangding Neijing, and it's the internal mesentery system. And correct me if I'm wrong, wasn't it about 8-10 years ago where Western medicine finally says the mesentery is an independent organ system? Has its own vasculature, its own function, and apparently they've had to rewrite a lot of these physiology books to include the mesentery as an organ, as a real organ. The Chinese did it 2,000 years ago. It's really amazing.
So you mentioned at some point here that if you went to China and talked to one of the people practicing Chinese medicine, they would be doing a lot of herbalist stuff. Is that something you delve into as well as part of your practice?
We fill 80, 90 prescriptions a day. And
so I guess the answer would be yes.
Yeah, that's a big yes. Here's the typical complaints that we see in this area: fatigue, anxiety, depression, insomnia, and then 3 or 4 pains. And then it can get fancy, coronary artery disease, arterial sclerosis, high blood pressure, all that stuff. And that's what we're treating. And mostly we treat it with herbs. We do use herbs. And pulse diagnosis tells you, my method is integrated. So the pulse will tell you what's wrong. And then what's wrong, and then you'll know which herbs that will fix that pulse. So the key with pulse diagnosis is you first have to know what a normal pulse feels like. And then if you see anything that's not normal, anything that's aberrated beyond the norm, the purpose of the herbs is to take that pulse and normalize it. If the pulse becomes normal, then the complaint is a lot better, if not gone.
Do you find that most of your patients have already been treated in the allopathic or chiropractic or other systems before they get to you, and they already come labeled with a diagnosis, which according to you may or may not be accurate? Is that something you run into quite a bit?
Yeah, we're statistically, I think we're at the bottom of the barrel in terms of people go to their guru before they come to us or their massage therapist or something. And I think it probably has to do with the energy stuff. MDs, even if there's a lot of, I think we counted it up once. We have over 30,000 patients in this small little community. So you can imagine we've treated probably 100 patients of every single medical doctor in this county. But I don't get a lot of referrals because I think they know I'm not an idiot because they see I'm jammed. They see that, and I have my own building and everything, and I've been here for 26 years. But because of that energy moniker, it's pretty hard for someone like an orthopedic surgeon to send somebody down the street to the energy doctor. I think that's one of the problems. I gave a lecture to the American Academy of Pain Management years ago to 500 anesthesiologists. It was in Vegas. I passed their test. They had a rigorous test, mostly pharmacology, and I passed it. So I became their token Chinese medical doctor. And they invited me to speak to their membership. And it was amazing. I mean, I gave a very detailed explanation of the sort of neurological mechanism of how acupuncture works and tried to clear up some of these misconceptions. Shawn, I got mobbed. I almost missed my flight. They literally rushed the stage. I was getting job offers from Mayo, Cleveland. And they said, finally, somebody described this so it makes sense. And when I came out 20-some years ago and began to tell the Chinese medical community around the world that qi doesn't mean energy, I swear to God, there's Satan, and then there was Bob. But they couldn't. I had all the proof. I had all the dictionaries. Show me in a dictionary where qi translates as energy, and they can't come up with one. Any medical dictionary. So I've survived over the years. Now they just accept, okay, that's Bob. But it's true. It is not an energy medicine. It's real physical medicine.
So obviously within I guess the Chinese, maybe in the Western Chinese medicine organizations, you're considered a heretic or something like that. But has anyone else adopted sort of your practice with similar results? Are there any people that are like saying this? Because obviously good results should translate. People should see that. So is there anybody else that's taken up this and learned this, or have you trained anybody on how to do this?
Yeah, I have an online Chinese university for postdocs. It's called Doane Online Education, Doane.us, and we hit 28 countries. I have 1,000 students all over the world. A lot of medical doctors, actually. Because in Europe, Chinese medicine in many countries is only disseminated through the medical profession. These guys are smart. They have their MD, PhDs like out of typical German. And then they also have a PhD in Chinese medicine. But they can't get it to work. They're frustrated. So they end up finding me. I'm a clinician. I'm not a scholar. And the only way to really get good at this is through massive volume. When you see 100 people a day, you make about every mistake you could possibly. Don't do that. And so you learn. My profession is dominated by scholars, Shawn. All the books are written by scholars who really have no clue how to get it to work clinically. There's very few clinicians in this medicine. Thus, that's why when you go to a Chinese medical clinic, they see 5 people a day. There's only one reason why there's 100 people a day clamming in here from all over the world is because we got it to work. And you just have to pay your dues because there's no standard of care. There's no AMA to tell you what to do. And you have to try to get it to work. And the books don't work. The books are not accurate. The scholarly books are not accurate. So to answer your question, I have probably 1,000 students around the world. practicing my methods everywhere.
So you'd mentioned obviously either chronic or acute pain would work well with some of the acupuncture techniques. You mentioned there's other chronic diseases. I don't know if you treat this or not. Let's say you have someone who is got some sort of systemic disease. Maybe it's, I don't know, rheumatoid arthritis or something like it, which we consider an autoimmune condition. How would that, I don't even know if you treat that, but how would that go? Or maybe you can provide something analogous to that. How would that go for you? What would the treatment look like? How often? How frequently? How does it progress? So on and so forth.
These people always have a typical pulse. It's pounding. It's strong. It's too strong. There's a lot of heat will make the pulse pound. And there's a certain pulse. It's called the left Yang pulse. If that pulse is really dominant like this, that's an inflammatory arthritic problem. And sometimes they're diagnosed. Sometimes they're not. A lot of times people can suffer for 2 or 3 years before that C-reactive protein goes up. And the typical drugs in the past were prednisone or its partner, methotrexate, and which had, I think, knocked the inflammation down quite a bit with terrible side effects, of course. But now you have this whole new group of drugs called biologics, and I must say, I see people in here all the time, and their hands are not hot, pulse is not pounding, and I grab their arm and I see they got this and this and this, but I don't see that autoimmune problem. And then they'll tell me I have rheumatoid arthritis, and I'll say, "Oh, you're taking Humira?" And they'll go, "Yeah." I say, "It's working." Herbally, we use anti-inflammatories to take the inflammation out. It works pretty well, but probably the biologics work better. And the only problem with the biologics, they really harm the immune system. So with these people, we don't try to replace the biologics. What we do is we go after and strengthen their immune system with the herbs so that the side effect can be ameliorated from taking those biologics. I don't know, does that answer your question?
Yeah, no, it does. I was just wondering what your approach was to something. Like I said, that would be, so you're going to take these herbs rest of your life, you're going to take it for a period of time, or when do you decide it's acupuncture versus, I'm just wondering what your treatment calculus is.
People they come in from all over the place, and even from China, believe it or not. And so I take a look at their pulse and I'll say, "You got all these, this is," and so on. And the pains we want to treat with acupuncture if they're local people, because acupuncture is a therapy. It takes a series of visits. But if they're at a distance, we treat everything with herbs. I usually only have to see a person once, and I can do everything at a distance by mailing the herbs to them. I do about 20, 25 phone calls around the world every day, and we're shipping herbs everywhere to Abu Dhabi and Dubai and Hong Kong and God knows where. And of course, we're treating at least 10, 15 times a day autoimmune problems. And there's a whole litany of them. There's rheumatoid arthritis, there's ankylosing spondylitis, there's Crohn's, ulcerative colitis, all that stuff. And I would say, if I had to grade myself, we're very good at the respiratory problems. IPF, some people think it's autoimmune. We do very well with IPF, I must say. That's idiopathic pulmonary fibrosis. And COPD, asthma is inflammatory. But as for Crohn's and ulcerative colitis, very often the drugs work better. They do. Because, of course, you have to ingest the herbs. And a lot of times these people have digestive issues, so it can be a little tricky. There's a lot of stuff I don't treat very well. The central nervous system ones are the worst. Multiple sclerosis, Parkinson's, Lou Gehrig's disease, I forget that one. Epilepsy, we're not very good at treating those. There might be a way to do it. I just haven't as yet figured out how to make any real serious inroads into those diseases. I can make some of their symptomology better. They'll feel a little stronger, but to actually turn the progression of the disease around, I haven't done that.
I would posit that maybe some of those diseases might not even existed in the Han Dynasty. I don't know. Did multiple sclerosis even exist back then? Is it something that we've been exposed to recently that's caused that? Because again, you said this is 2,000 years old, and I would suspect that, potentially a lot of these diseases didn't show up very often. Their incidence has increased dramatically over the last 30, 40, 50 years. And that's obviously way after Han Dynasty for sure.
No, you're absolutely right. The people didn't live that long. The average lifespan was about 32 years old. So there were two types of Chinese medicine that developed in China. There was what we call barefoot medicine. These were little guys that went around from village to village with a bunch of herbs on their back, and they treated contusions and broken bones and things. They're like little ER specialists, okay? And that was all over China. But a very sophisticated level of this medicine developed in the emperor's court, because you have these 2,000 years of emperors, basically. They almost always took China by force. These are not nice guys. And after they subdued all their enemies and the kingdom calmed down, then they would send their army out, or a battalion, or whatever. They sent their people out to find me the smartest doctor in the land and bring him here. And they'd find some guy, and they'd bring him and his family to the court, and the emperor would say, look, I want to live to be 100 years old. I want everyone to be terrified of me. I never want to be sick. I want to leave my army into my 90s. I want perpetual sex. I got 200 concubines. Make it happen, or I'll behead you. And they were highly motivated to get it right. And these are smart guys. And very quickly they realize the son of a bitch, it's the heart. If we can keep his heart going, and if we can keep the pipes, the mai, wide open, he'll live a long time. And so in the emperor's court, this very sophisticated cardiovascular medicine developed, completely independent of the barefoot stuff that was going on in the villages. So we've taken that emperor's medicine, and we're trying our best to deliver it to the local public here and to other people that come in from all over the place.
Just out of curiosity, and I'm completely clueless on herbal medicine, but what kind of herbs and stuff like that would be effective for certain things? Can you discuss that?
Yeah, Chinese herbal medicine survived the onslaught of Western medicine because they figured out, no one ever figured it out, to my knowledge, except maybe Ayurvedic medicine in India, but all the indigenous medicines in the world were basically eradicated with Western medicine. All the Polynesian medicines, the African, the South American, because Western medicine was just better. The only thing that really survived and flourished was Chinese herbal medicine. And I believe the reason why is because they figured out how to use polypharmacy formulas to treat many different things at once. They figured out how to combine herbs together to treat multiple problems. And because of that, they survived. Western herbalism in the Middle Ages, it was one herb for your sore throat, one herb for the ringing in your ears, one herb for this, one herb for that. In Chinese herbal medicine, we're using 30 or 40 herbs in one bottle. I carry 1,000 herbs here on premises in the other room. And it's not atypical to have 40 herbs in a formula, because you can usually there's herbs to take away the pain. There's herbs thrombolytics to try to clean up the coronaries. There's herbs to increase the contractility of the left ventricle specifically to make the heart beat stronger. There's herbs for anxiety, herbs for sleeping, herbs to dredge out the liver, fatty livers. It's an intellectual dream come true for someone like me. I'm 77. Why am I doing this? Because the people get better, a very large percentage get better, and there's 9,000 herbs. So there's no way you're going to get a complete handle on this thing. It's a thinking game, and it's a lot of fun. I must say it's a lot of fun because everyone's a puzzle. You're trying to figure out what the hell's the matter with this person. And we don't discount Western medicine. We like it, actually. But their efficacy is basically trauma. They get in trouble with the chronic problems because, of course, it's drugs forever, right? And with side effects. Carry a lot of herbs, Shawn. It's never just one herb. It's groups of herbs. Like thrombolytics. What do we do for that? And then you go to the bugs. We're using leech and cockroach and scorpions and all kinds of stuff. You don't have to eat the bug. I cook the bug for you, and I throw the bug away, and we turn the tea into a powder. The powder is concentrated 6-to-1, and the patient takes the powder. When the powder hits hot water, it dissolves, becomes a tea, and the patient drinks the tea. And it tastes terrible, so you got to man up and take your herbs.
It's not like one of the newer drugs out here. Some of the GLP-1 drugs are derived from venom from Gila monster. It's not implausible to think that, well, a lot of these medicines are derived off of different plants and different animal products to make that. And so this is something that was maybe done in a way that predated modern industrial techniques. I was going to ask you, as far as, have there been, because a lot of folks in Western medicine, they like to see RCTs, they like to see studies on it. I know I've seen studies around acupuncture for sure. How much of the stuff you're done has been exposed to, like particularly the herbal stuff? Because I'm sure somebody's done an RCT on this herb or that herb, or is there much data on this been published?
Yeah, the Chinese are pumping out thousands of studies. The problem is they're not very well done. Half of them are not double blind. They're mostly anecdotal. So I don't really pay much attention to them. The problem is somebody's not going to spend $100 million to try to prove that some natural medicine works, because, of course, you can't patent a natural substance, so there's no money in it. I've been told that in Beijing and Shanghai, every single major pharmaceutical company in the world has a presence there, and they are, because you have this Chinese pharmacopoeia, it's very detailed, a lot of books, and here's the herb, and here's what it does, and here's the pharmacology as much as we know of that herb. So we already know what the herb does through antiquity, and clinically we know what it does. So these drug companies they're grabbing these herbs, and then they're trying to figure out what's the active ingredient in that herb, and they're trying to patent the extraction process. Thus, a lot of drugs are coming to market that are really based on Chinese herbs. The only problem is an herb might have 1,000 ingredients, and it synergistically works on the patient. You can't just pluck out one thing and expect it to work as well as what the herb would do. So with Chinese herbal medicine, it's far more benign. It's very difficult to put someone in the ER with Chinese herbs. I mean, you could do it, you could screw up, but in most cases, it's a food product, concentrated food product. So it's more benign, it's more gentle on the body than pharmacology, basically.
Yeah, I guess to my question I asked before, because I don't quite know that I got the answer. As far as like treatment duration, can you give an example of, this is a condition, this is how long it takes to treat? Can we cure things? We don't like to talk about cures very much anymore in Western medicine, because it violates the business model. But are there any curative things that you can do?
The entire medicine is basically trying to be curative. But as you say, the word cure is a legal term. It means something would never come back. So we don't use the word cure. But the medicine is trying to zero in on what we think is really causing the problem, and then we're treating that. And so here's 20 years ago, we would sign people up for maybe 8 or 9 month plans where we give them acupuncture and herbs and so forth. But over the years, we just become better at it. And so now a typical plan is about 4 months. We'll take on 3 or 4, 5, 6, 7 problems, treat it simultaneously: herbs, acupuncture, herbal consultations. And the patient will either come here over 4 months, or we'll talk to them each week on the phone, ship the herbs to them. And we expect in most cases the patient to feel 70, 80% better in 4 months. Now, will the patient need to take herbs longer? If they're older, yeah, they'll have to take the herbs on a maintenance plan. Because very often when you get older, the body it's entropy. Nobody's beaten it so far that I know. And so I recommend people in their 60s, 70s, 80s to take, if they can, to take the herbs longer, if they have the money, to take the herbs longer to be able to maintain the benefits. The younger people, 4 months very often is enough to snap them out of the problem. Just an interesting side note, in Chinese medicine, if the heart wall is not getting enough nutrient, if the muscular pump of the heart wall is not getting enough nutrient, then the brainwave patterns will be anxious. And the person will have trouble sleeping. And the person will be tired, of course, because they don't sleep. Now, in Western medicine, this guy here, if there's any kind of anxiety or anything, this guy here gets separated from the rest of your body and goes to the psychiatrist, and then, of course, the internist takes care of everything below here. But in Chinese medicine, anxiety is very often associated with a heart dysfunction. And so we're treating a lot of anxiety and depressions and so forth. We don't think that the brainwave patterns are an independent agent, that you just don't get anxiety because of a brain chemistry problem. There might be one, but we think the underlying cause is elsewhere, and it's usually located below the neck. If someone has a fatty liver or if they have restricted blood supply through the liver, very often the brainwave patterns are depressing. If the liver is inflamed, usually the brainwave patterns are very angry and frustrated. If there's restricted blood supply into the heart, the brainwave patterns are very anxious. And so we're treating a lot of these kinds of problems by treating the physical organ system. And I must say, it works really, really well. One of my things I've said over years that if somebody wanted to get a PhD and they're in med school and they wanted to get a PhD also, it would be so easy to do it. All you'd have to do is get your hands on 5,000, 10,000 charts with people with diagnosed heart disease. And that will be easy because there's a plethora of them in any hospital system. And all they got to do is look in that paperwork. And you dig down deep, a few pages down. I swear to God, they're going to find out that every single one of them are anxious, can't sleep. Nobody ever looked, to my knowledge. They didn't look. You say anxiety and depression, oh, that's psychiatry.
Unfortunately, we just run out of time here, Bob. I appreciate it. Maybe can you share websites, social media, anything you would so people can contact you if they have an interest in this?
Our clinic website is acupuncturewellness.net, and my teaching website for docs is doane.us, DOANE.us. That's a very large teaching. There's, 2,000 hours of teaching on how to treat anything you can dream of with Chinese herbs and acupuncture. So yeah, thank you very much for inviting me. It was a pleasure. I've been following you. And by the way, just to show you this, we've been doing Carnivore Diet since 1999.
Interesting.
Oh yeah, we've been putting them on eggs, fish, chicken, and meat, and minimal green vegetables, minimal. And then we recommend that the minimal should be 60-40. When they look at their plate visually, the meat, the animal protein has to be at least 60% of the plate visually. But we recommend all the way down to 100-0. And usually they can't palpate that. They can't take that. We'll say 90-10. So this is your vegetable. It should be green, not sugar vegetables, green ones, complex carbohydrates. And the rest of it should be animal protein. We've been doing that, I swear to God, since 1999, 2000 in that area. Yeah. And for weight loss, it's like magic.
Yeah, we see that for sure. I'm glad to hear that. That's good to know that. And like I said, I think this goes back hundreds of years, quite honestly, this meat-based stuff. So anyway, I know you got to go. I got to go as well.